Good morning, Lagos. Good morning, Nigerian. Good morning, listeners. Yes, you tuned to Overt Radio. This is Ibukun Olua. Welcome to Healthline right here on Overt Radio. Every Wednesday we do Healthline on Wednesday from 10 to 11 o'clock. This is 60 minutes past the hour of 10. Your Wednesday morning health and wellness show. Today's topic is one of the topic that touches every woman out there. Women's health matter from menstruation to menopause. I'm sure you would love to hear this again. Every woman's body goes through these stages from the first menstruation period to the end of our reproductive years. But unfortunately, many still don't understand what is happening inside our body. Inside this body, many people, many women don't understand what is going through there, or they rely on misinformation. This morning we'll be shedding light on these important topics, breaking the silence and helping women understand how to take better care of their health. So this is what we'll be saying today. Let's begin with a short overview of this. Menstruation is the neutral monthly process that prepares a woman's body for pregnancy. It's a part of a healthy reproductive system, both for many young girls. It begins with confusion, fear, and even embarrassment because nobody really talks about it openly. Then comes to menopause, where we say anyone doing menstruation out there, from ladies to women, they'll feel, this is embarrassing. I can say this openly outside. Then let's go to the menopause stage, the stage when menstruation stops completely. Unusual between age 45 to 55. Some women experience hot flashes, mood swing, or sleep problem during the time of menopause. These are normal biology changes, but they requires understanding patients and medical attention when symptoms become severe. To help us break it all down, we will start with a medical perspective. We have here with we have to call we have Doctor we have Doctor Eniola. We have Dr. Eniola here. We're going to call, he's a guest. We'll call in. He's a calling guest, Mr. Eniola, a medical doctor with experience in women's health. Oh, let's give a call to Dr. Eniola to put more insight into this, because okay, let's hold on to hear from Dr. Eniola. Good morning, Dr. Eniola.
Hi, good morning.
Good morning, good morning, good morning, Dr. Eniola. This is over to
How you
radio.
doing
You
today?
can you hear, sir?
You said what?
Where are you calling from, sir?
Currently, I'm calling from Abeokuta.
Abeokuta.
Currently, I'm coming from yeah,
Okay, you are on here, sir,
yeah.
here on Hobart
Okay.
Radio. Here on Hobart Radio. Our listeners are hearing you. We want you to put more insight about our topic for today is women's matter, health, women's matter. It's about menstruation to menopause. Some ladies go through menstruation during from their early age, and less after menstruation they go through menopause stage. The menopause stage is when different things start happening. We want you to put more insights about it. We want you to put more about it. We want you to put more insight about it. Let me ask you some few questions, doctor. Let's start with a simple question.
Yeah.
Can you explain what really happens in a woman's body during menstruation and why it's such an important part of reproductive health?
Um. Thank you. Good morning once again. Good morning, the listeners. And like earlier stated, my name is Dr. Olainola. I talking about women's productive health. It's not something we can just I don't think it's something we can just take from the middle or from the later. We have to start all over. It starts, there are about 4 or 5 developmental stages in a
Okay,
woman.
okay,
You know, the stages of puberty to the stage of the reproductive stage. which the menstruation phase, so the pre-menopausal stage,
Okay.
and also to the menopausal stage. So all these developmental stages have their own peculiarities and are interwoven. Take for instance, the puberty stage. For for a child to attain the puberty stage, at least the child must be from 8 to 12 years of age. No,
Okay.
though it varies depending on genetics at times, but usually it's between the age of 8 to 12 years, and there are
Okay.
some certain things that I expected to that you expect to see in such a child for you to know that okay, this child is actually of puberty stage. Developmental stages like having grown the breast, or
Okay.
having a pubic hair, or some whitish vaginal discharges that comes out often from the vagina. Those are some of the signs of puberty. So and at this stage, the body starts producing some chemicals. We call them some hormones, estrogen and progesterone, which are very, very essential in um, the the second phase of hello, are you there?
Yeah, I'm here, sir. I'm here, Mr. Dr.
Yeah.
Owoduni. I'm here.
Which yeah, which we believe are very, very essential in getting into the second phase, which is the reproductive stage.
Okay.
Usually the reproductive stage starts from the age of 12 to about 40 to 45 years, depending on the menarche and the menopause. Menarche, what I mean by menarche is the onset of menstruation.
Okay.
And to till the menopause. And menarche depends on, there are so many factors that can affect that can so many factors depends or can give rise to either early menarche or late menarche.
Okay.
A child can see a message probably because when the mother we call it genetics. When the mother sees a menses earlier, chances are high that the child or the lady or the girl might see as menses also earlier.
Okay.
Body weight also, for babies or for child or for children that are underweight, or they do a lot of excessive physical activities, as in case of athletes, or they've not been eating too well, malnourished. Those kind of ladies or this kind of child tends to see their menses late
Okay.
compared to other people. And we have some people that are also overweight. When somebody is even overweight at times, it also affects early menarche.
Okay.
People like that might see their menses earlier. Then I
Okay.
think I already mentioned nutrition. When
Yes. Yes.
somebody is not feeding well, it also can affect menses. And most importantly, environment also plays a major factor.
Okay.
The socioeconomic status of somebody, the stress level of a child can also affect or influence early menarche.
Okay.
So those are the first part, the first phase of the first stage of a woman's life. That is the puberty stage.
Yeah.
Now going into the reproductive stage,
Okay.
which we all refer to as the menopause.
Yeah.
The menstruation. The reproductive stage is usually characterized by the series of monthly shedding of the uterine lining, and that we call it blood and particles or tissues via the vagina in preparation for subsequent pregnancy.
Okay.
And this series of process. It happens in four stages also, in four different stages. And so there are so many things that can affect it, and it can either affect it positively or affect it either or negatively. But as a woman enter into stage of menstruation or a reproductive stage, like I said earlier, um, the menstrual cycle, no, starts, and the menstrual cycle, like I said earlier, the normal typical um, the typical um, stage, the typical changes, in normal cycle is between 24 to 38 days in some people.
Okay.
The cycle is between 24 to 38 days in some people, and usually the bleeding usually lasts between 3 to 7 days in some people. Between 3 to 7 days, that's the average in some people. However, we have some people that last longer, that last more than 7 days, and some people that doesn't even have up to 3 days. Those can be due to some medical condition, underlying medical condition,
Okay.
that probably they still need to see their doctors to talk about or to discuss about.
Okay.
And and
Do you want to say
and
something,
these
sir?
changes, like
Okay.
yeah, yeah. I thought you wanted to ask a question
Oh
earlier.
yeah, I wanted to ask a question. I was asking if you were done, sir.
Well, I have so many things in my head right now, but
Okay,
you
okay, okay.
can
I
just
have a
go ahead and
question.
ask
I
the
have a
question.
question. I have a question. We used to have this woman experience when during their menstruation. It is always painful during period or irregular cycles occur. Sometimes it comes early and sometimes it skips. What usually causes that kind of thing? What usually causes that?
Yeah. The pain you are referring to, medically we call it dysmenorrhea. And dysmenorrhea in some people, it may be severe, and usually it can be life threatening for some people. And it's, it comes about frequent menstrual cramping that can disrupt the daily activities, and sometimes can be either it can be caused by either hormonal imbalance, when there's an imbalance in the hormonal production, or there's an underlying medical condition. There's so many underlying medical conditions that most of our ladies doesn't even know they have. Conditions like there's something we call endometriosis, there's uterine fibroid, and conditions like that. And if one is having such an underlying condition and you are not aware of those conditions, it's always best you visit your healthcare provider to find out what exactly is going on, why is the menstruation is being life threatening compared to the other counterparts.
So, sir,
And
are you
some other
saying
conditions.
okay, okay? So, sir, are you saying those kind of condition are the condition that cause pains,
Yeah,
or that the
so
ones that
yeah,
cause irregular
yeah.
cycle?
No, we are talking about the pain,
The
this
pain.
menorrhea this time
Okay,
around. We are talking
okay,
about pain,
okay,
pain during menses. There's some
okay,
odd underlying condition. It could
okay,
be this, it could be pelvic inflammatory infection. It could be polycystic ovarian cyst. It
okay,
could be a uterine fibroid. It could be endometriosis.
okay.
So many underlying conditions can be a factor. But having an irregular menstrual cycle is entirely not a bad thing while during reproductive age, because it is believed at one point or the other there will be like some hormonal changes, and hormonal changes can happen at any time, you know giving rise to one having irregular menstrual flow at some point, not for a very long time. But
Okay.
in a situation whereby you notice that you're skipping, the message is being skipped for like 2, 3, 4, or 5, 6, or 7 months, at most for 12. Usually, for you to skip your message for 12 months, that means the person already started the premenopausal stage. But don't let us go there yet. Let's talk about a irregular menstrual period now.
Okay.
So when you're having an irregular menstrual period, like I said earlier, it's not an entirely a bad thing to have an irregular menstrual period, because there's so many factors that can cause want to have an irregular menstrual period.
Okay, can you give us that briefly,
The
sir?
factors, yeah, sure.
Okay.
The factors ranges from conditions like like a person that has a polycystic ovarian cyst. Polycystic ovarian cyst is when it's an infection, like a cyst, like a blister formation, an infection of the ovary.
Okay.
Poly means many blisters, more than one blisters affecting the ovaries.
Okay.
The ovaries is like an organ that initiates the menstrual flows.
Okay.
And when the ovary is infected, definitely it will automatically affect the menstrual flow.
Okay.
So, and incessant use of some medication. Now, ladies of nowadays are so fond of using some certain medications that unknowingly to them, they are destroying or disrupting their menstrual cycle.
Okay.
Like like the regular, the hormonal, the emergency contraceptive pills.
Okay.
Like some other hormonal medications. When you use something like that, it disrupts the regular flow, and irregularity in the menstrual flow. And infection, poorly treated or untreated infection, STI, and what have you, are some of the major causes that can also give rise to one having an irregular menstrual flow.
Yeah.
Not to mention exercise for people that are for athletes that people that engage in very active physical activities like athletes. Most of them tends to have this condition also, irregular menstrual flow, or in fact, some people you just notice for a few months, a month or two, they may not even see their menses. Not that because they are having any medical condition, but because of the strenuous activities they continuously they get themselves involved in. So that is why
Thank you.
it affects their normal hormonal fluctuations.
Thank you, Dr. Owoduni Olainola.
You're welcome.
We have two more questions for you. Some women struggle emotional during menopause. They have mood swing, depression, or even low self. They have low self esteem during this stage. What can you say? What can you say? What can you say about that? From a doctor's point of view, what can you do to cope better? What can you say about that?
Thank you very much. Usually, to officially say that one is has attained the stage of menopause or premenopausal stage, the person must have had about 12 months of cessation of menses. 12 months, that's about a year of cessation of menses. And in situation like that, there are some hormones in the body that will drop, that are expected to drop significantly. Those are the estrogen and the progesterone hormone that are normally should drop. And when you're having a drop in that those kind of hormone, it has some health factors. There are some health conditions that would likely happen when you are having a reduction or a lack of estrogen, for instance, in the blood, in the body, and conditions like cardiovascular disease, like stroke, like heart attack. It's very, very common with people. Even osteoporosis, there's something we call osteoporosis because estrogen is believed to help with its head um, um, bone production and to solidify the bone. But
Okay.
when the estrogen level is reduced, definitely it will cause the bone to be very, very weak, and there will be, bone weakness, and the density will be very, very weak. And that's why you see most of them complain of weakness, and
Yes.
fracture is very, very common.
Yeah.
And also their mental health because of anxiety,
Okay.
because the oxygen level is reduced, there will be anxiety, there will be
Okay.
mood swing, there's this depression, and for some people, there's poor sleep. Those are
Okay.
some of the signs of
Okay.
menopause, of the menopausal stage. And those cases like this are not entirely abnormal.
Okay.
So, but whenever any of these cases arises, it is best to see your
Doctor.
medical expert, a medical
Okay.
expert, or your
Okay.
doctor
Okay. Thank you so
to
much for
attend to it.
this, Mr. Dr. Owodone. Before we go on a short break, what are the three simple lifestyle tips you would recommend to every woman listening to this morning program to maintain a healthy hormonal balance?
Um, for all women, um, throughout the stage, throughout the different women's developmental stages, be it the puberty, the reproductive stage, or the menopausal stage, it is very, very pertinent to note that adopting a healthy lifestyle, it is, in fact, is nothing but the most important thing. And how do you do that? Making sure you have a good nutritious diet,
Okay.
eating a well balanced diet. It's very, very essential.
Okay.
Regular exercise, not like physical, not like just regular mild exercise is also avoid smoking because I know this is very, very common among our young ladies of nowadays. They take anything, smokes, do weed, do all sort of, and make sure you make your doctor or your nurse or your caregiver your friend. So make sure you voice out anything that
Okay.
you notice. If you notice anything, visit your doctor either instead of having to to
So
be using an over-the-counter medication or using all this herbal preparation. And conclusively, um, ensure you don't take unnecessary birth control pills
okay.
without consulting your medical practitioner.
Okay.
So, and because I noticed these things are very, very rampant in our society right now,
Yes. Yes.
and it's really causing a lot of havoc. And doing regular,
Okay. Okay. I think there is a network issue.
yeah, sorry,
Okay. Okay.
sorry. When I talk about regular checkup, so
Okay.
many things are involved when it comes to this. You do a pap smear test, you do an HCS, you do all necessary tests just to check yourself up, and this is best done at least periodically. Three times twice in a year. Some school of thought will tell you 2 times in a year. So I still believe 3 times in a year is not a bad idea.
Okay, thank you so
So
much, Dr. Owodunni Ola Eniola. We are glad we have you here. Thank you so much. And don't forget to follow us on our various social media handle. Are you here, sir? Instagram at Overtunes, Facebook at Overtunes, X Overtunes NG, TikTok Overtunes TV, and YouTube Overt Radio. Thank you, Dr. Owodunni Ola Eniola. Thank you, sir.
thank you. You're welcome. I
Yeah.
really appreciate it. Thank you.
So, listeners, that is very insightful. We will take a short musical break now, and we will return. We will continue with another perspective. This time from a woman's health educator. This time we're going for a woman's health educator. I want you to stay tuned because you've learned a lot from Dr. Owodunni Ola Eniola, and I'm sure this time our health educator is giving us another perspective, another part of our side. So I want you to stay tuned on this program. Don't go away. We'll soon be back. Thank you. Welcome back to Healthline on Hovet Radio. If you're just joining us, we have been talking about women's health matters from menstruation to menopause. Before the break, Dr. Owodunni Ola Eniola helped us to understand the medical side, what happens during menstruation and menopause, and why regular health checkups are so important. Now we are switching to the emotional and lifestyle side, how women can manage these changes day to day and stay mentally strong. So we'll be calling on our health educator. Let's give a call to let's give a call to her. Good morning.
Good morning.
Good morning, Mrs. Ayobami. Good morning. This is Over to Radio. You are on here right now. Our listeners are hearing you. Thanks for joining us. Thanks for joining us on Women's Health program. We were talking earlier. We were talking about menstruation to menopause. We want you to give us more insights about it. We know you have worked with so many women across different ages group on awareness and lifestyle. We know more about you. We want you to give more insight about menstruation and menopause, Mrs. Ayobami.
Okay. Good morning once again.
Good morning, Ma.
Like we all know, the general meaning of menstruation, and we know the general meaning of menopause. But you see, menstruation um is the monthly flow of blood
Okay.
from the vagina, and it is also the period where the uterus release its lining.
Okay.
So at this point, you see blood. Now, from for a teenager or for someone who has not experienced this before, it will look like a miracle. It will look like something she has never witnessed.
Okay.
Now, at this point, we need to know it is a natural thing that God actually deposited in women, and it is by force we need to go through it.
Okay.
Some go through pains, and while some does not. You
Okay.
know, the endometrium, the endometrial organ in the female reproductive organ rather, it's it stretches. Do you understand? So now at this point, when some people experience pains during their menstrual cycle,
Okay.
and some does not experience. So when there is an expansion in it, some people will come and they'll tell you, "Wow, mommy, I'm feeling pain. I'm going through pain, and I don't know what to do. Should I take this drug? Should I do this? Should I do that?" And I will advise people, aside um for the fact that when a girl child is going through this, probably there's another occurrence. Maybe there's a temperature, or probably the pain is on the eye side. Then I will advise such a girl to take a medication. But without that, there are natural things that we can use to relieve the pain.
Okay.
Now, some people in our country now, let me say nowadays, we see children of age 10, 11, 12, 13. telling their parents, "Mommy, I'm seeing blood. I've started menstruation. I've started menstruating." And of which, in the olden days, those days, you see ages from 1920. Some people even start at 21.
Okay.
But now we see children of 10, 11, 12, 13 of age that they're starting their menstruation at their early age. Now, my advice to mothers, especially when they notice their children are about to, or they are about to move to that age, let me say age 10, 11, 12, they should prepare their mind for the menstruation time. So it won't meet them at a shock. They won't be shocked when they see it.
Mrs.
They'll know,
Ayobami.
okay,
Okay, Mrs. Ayobami,
yeah,
sorry. Sorry for cutting you. You see, many girls start menstruation without any preparation or education from home. We know that some girls, they don't have education from home when it comes to menstruation. From your experience, how should mothers or guardians talk to their daughters about the natural stage?
yeah. Like I was saying, that is what I was about to say.
Yes.
That mothers should prepare the mind of their girl child against the menstruation period, against the menstruation time. Like telling them how to clean themselves up, telling them how to make use of a sanitary pad, telling them how to be very neat during their menstruation period, and telling them how to abstain from opposite gender. Abstaining from opposite gender is not them not talking to the opposite gender, no, or playing with the opposite gender. But you see, at the period of them going through their menstruation period, they tend to now grow more. You see breast enlargement, you see them having public hair, you see this rapid growth will just come from anywhere. And from that, they'll become attractive.
Yeah.
And when they now become attractive, opposite gender, you know how boys of nowadays, they'll be attracted to them, and before you know it, something else will come up. So parents need to start preparing their girl child from a tender age of 10 and above. Once your child is about 10 years, start preparing her mind. Okay, you might see something like this. This is how you do it. This is how you go about it. You get the sanitary pad. And when you see, in short, I love the fact that always, like the company always, and some sanitary pad organizations are now going to schools. They're going to schools to teach children, girl childs. They're going there to teach them and give them sanitary pads. So they have it at home even before their menstruation starts.
Yes.
So our employed parents, especially mothers, that they should prepare the mind of their children against that period, because some children, they don't even, when the thing comes to them as a shock, they don't, okay,
They
an
used to feel
introvert,
they feel ashamed.
yes, especially an introvert, a girl who is an introvert,
Yeah.
she won't want to talk, and probably she might even now tell her friend, I am seeing blood. And if that girl or her friend that she's now talking to is does not grows up to be a bad child, the friend will lead her astray.
Some cultures still makes girl feel unclean or ashamed during this period, during their period. What can community or schools do to change that kind of mindset?
Now, like I said, you see, no community starts without the family.
Oh yeah.
So everything starts from your home. If a mother can make a child, a girl child, courageous, bold enough to stand anything, any body shape, any insult, anything, if a mother can make a girl child very bold to attend to anything coming forth, then there won't be any issue. Just
Okay.
imagine someone telling you, okay, because you're on your period, you can't you can't move near me,
You are
or because you're on your
stinking.
period, I can't eat with you. So instead of the girl child to feel down or feel somehow, once the mother has been there, telling her, encouraging her, and telling her, once this period comes, you have to be bold and courageous. You need to
Mrs.
focus.
Okay. Mrs. Ayobami, let's switch to the menopause stage. Let's talk about
Okay.
the menopause stage. Apart from the physical symptoms, many women face emotional challenges like loneliness, anger, or low self-esteem. How can women stay positive and confident during the stage?
You see, this period, women's their ages varies. They tend to start at age 45 above, 45, 50 and above. You see, and this period, it is a period of old age. This is where the period where old age starts. And I would tell it comes with different things, like you said. Some will tend to now start getting angry. Some would, and some, in short, some will start, their blood flow will now start, I don't know how to put it. We start, it won't come regular. It will be an irregular menstruation. Yeah, let me put it that way.
What role do you
Yes.
think the husband or the family member play during to support women like this going through this menopause or menstruation pain? How can
I
men
will,
be more understanding? Can you breathe that? We'll soon round up the
I will
program.
implore I will implore husbands, like men of the house. You see, the same way our body system reacts to our menstruation when we start, it is the same way our body system will react to it when it stops.
Okay,
So I implore husbands, men of the house, to please be there for their wives.
good.
In as much they are there together, they've been there together, they should please and please
Be
stay
there for the
with
wife.
them, care for them the more, because it is not them, it is their body system.
Okay, finally, can you share some simple daily tips in terms of diet, exercise, stress management that helps women stay healthy at any age of this menopause?
Okay, like I said, it is the stage where old age starts.
Okay.
I would tell women of that age, 45 to 50. In short, I tell people from age 40, when you get to age 40, you stop taking some kind of foods that can actually be toxic to your body, like carbonated drinks, red meats, a lot. They need to stop them. Take more of fruits, take more of water, take more of vegetables, and do a little exercise. No, not a lot of exercise, because your body cannot take it anymore. So they just do a little exercise.
Okay, thank you so
Yeah.
much, Mrs. Ayobami. That was so encouraging and practical. Women really needs to hear this. Thank you, and don't forget to follow us on our various social media and Instagram at Overt News, Facebook Overt News, X Overt News, Henry, TikTok Overt News TV, and YouTube Overt Radio. Thanks for your time, Mrs.
You're
Ayobami.
welcome. You're welcome. Thank you.
So, listeners, this has been a very rich conversation from what both Dr. Owodunni Ola Eniola and Mrs. Ayobami shared. One thing stands out: understanding your body is the key to living a healthy life. Menstruation and menopause are not sickness; they are natural part of womanhood. The more we talk about them, the less fear and shame this would be. To every woman listening to this program this morning, please don't ignore your health. Your health is very important. Health is wealth, as we say. Visit a doctor if you notice any unusual changes in your body. Eat well, rest well, and go for regular checkup. Until men support the woman around you with love and patience. And that is where we'll draw the curtain today on Outline right here on Hovot Radio. I'm Ibukun Oshodikpeng. A big thanks to Dr. Owodune Ola Eniola and Mrs. Ayobami. Thank you for joining us by phone call. Join us again next week, same time by 10 a.m. to 11 a.m. Just 1 hour program every Wednesday, Outline Radio, for another Outline conversation. Ibukun, don't forget your favorite. Stay healthy, stay informed, and stay confident.